Hello, thank you for watching Channel 24. Blood transfusions are the #1 procedure performed in hospitals across the world. Our blood supply is the safest it has ever been, and blood transfusion saves lives. However, emerging research shows that patients that receive blood transfusions have higher rates of infections and longer lengths of stay. Hospitals and physicians are now focusing on giving blood only when needed. Initiatives such as helping patients optimize their own red blood cells prior to surgery and informing them about the risk of blood transfusions are important for the safety of our community. Please welcome with me Beth Murph, Transfusion Safety Officer and Patient Safety Officer at St. Bernard's. Beth, how you doing?
I'm doing great, thanks.
Good. Now, Beth, tell me, what is blood management?
Well, blood management is a program that focuses on using the latest research to ensure that our blood supply is utilized real carefully at the medical center level, as far as that every patient that gets blood is the right product for the right patient at the right time.
Okay, and now we're focusing on the educational side of this, and why is it important that the public know and be aware about the blood management process?
Well, you know, a few years ago, if you might have been comparing your experience, let's say you have a friend who might have had a certain procedure at the hospital and they might have received several units of blood. Well, you may not experience that if you had the same procedure now. And it's just important to realize that the reason for that is we've realized that we used to kind of think that you could just give blood as sort of an extra. Hey, let's just try a couple units of blood. And now what we've realized is, hey, that really needs to be reserved for when it's absolutely necessary. So patients just need to be aware that their experience may be a little different than it might have been 10 years ago.
Sure. Now, if I'm getting ready to have a procedure, a surgery of some sort, and I'm talking to my physician, what sort of questions should I ask about blood transfusions or the blood management?
Well, you want to ask your physician how they make the decision about blood transfusions. You want to make sure that you feel like they have explained to you when they use transfusions, and that they've explained the risks and the benefits real clearly to you. You also want to make sure that your physician explores other opportunities to help your body make their own red blood cells. For example, one of the things that we have found helpful is folks that are going to have surgery, we can bring them in a little bit earlier and give them IV iron, and that helps them make their own red blood cells.
Okay. Now, this blood management process, why is it so significant in the current technologies?
Well, because like you mentioned earlier, blood transfusions are the #1 procedure throughout the hospitals. But this new body of research has been around about 10 years, but there are only about 75 folks that are actually called transfusion safety officers in the country. And so it's really significant to think that we have that in this area. You know, Jonesboro not being the largest city in the
Sure.
universe. So it's really significant to realize, hey, we have this significant program right here in Northeast Arkansas.
Okay. Now, you mentioned that the risk associated with receiving blood transfusions or units of blood, is it safe to even get blood transfusions?
It's very safe, and like you said earlier, it's the safest it's ever been. Our blood supply in the United States is extremely safe. But one of the things, I've been a nurse for a while, and I never really thought about, you know, blood from the time it's donated to the time it's given. Actually, blood is a liquid transplant, but that fluid actually sits in the bag for up to 42 days. And if you kind of think about that, you know, it makes just good sense that it can't be exactly the same on day 42 as it is on day 1.
Right.
Now, it's very, very safe. And we have a whole organization in the United States called the AABB that monitors that. And, of course, we do that in this area as well. But just the whole concept of it sits in the bag for 42 days, really not the same going in as it was coming out.
Sure. So it's not necessarily that the process is a problem or is risky, but just the risk associated with receiving
Absolutely.
transfusions.
Process is very, very safe. In fact, we really encourage blood donation. I gave blood yesterday. It's a very precious resource, and that's one of the things that drives this whole program, is because blood saves lives, but we need to have it available for the people who actually need it. And so we don't ever want to give it to anybody who might just, it's not going to hurt them, because it actually can have risk in and of itself.
Okay. Well, Beth, thank you so much for sharing the information with us. And I encourage everyone to, next time that you're about to have a procedure done, to talk to your physician and ask some of these same questions about it, and make sure that you only receive it if it's absolutely necessary, correct?
Absolutely.
All right. Well, Beth, thank you so much for sitting in with us. And thank you guys for watching Channel 24.